Hi, I'm Tracer Foster, your home health care agency business consultant. Welcome back to the Home Health Care Agency Administrator Training Program, module number 5. In this section, we'll focus on another critical aspect of running a successful home health care agency, workforce management. As the administrator, your staff is the heart of your agency. Recruiting and retaining skilled caregivers and office staff, ensuring their ongoing training, evaluating their performance, and complying with labor laws all play a role in maintaining a high-performing, reliable, and legally compliant workforce. So let's start with the foundation: recruiting, hiring, and retention strategies. Hiring and keeping top talent in home health care can be challenging due to high demand and caregiver shortages. A strong recruitment and retention plan is essential for building a reliable team. First, consider recruiting the right candidates. Targeting the right talent, focus on your CNAs, your home health aides, your RNs, and LPNs with experience in home health or home care. Use multiple recruiting channels. Consider posting job openings on job boards, social media, and attend industry networking events as well. Offer employee referral programs. Encourage existing staff to refer qualified candidates and offer them employee referral bonuses. Have a streamlined application process. Reduce hiring barriers by having a simple online application process. Next, follow hiring practices that apply to your type of agency. Conduct thorough background checks when required. Verify all licenses, certifications, and criminal records. Make sure that you have competency assessments in place. Test the clinical skills of your employees before hiring them. An office with a training room and equipment is helpful for these demonstrations. Conduct behavioral interviews. Ask situational questions during the face-to-face meeting to evaluate problem solving and patient care skills and how someone might have handled a particular situation in the past. Also, make sure that this is a cultural fit for you. Ensure that your candidates align with your agency's values and patient-centered approach. A well-dressed candidate with a smile on their face will make a great first impression on you. Finally, retention strategies. Competitive pay and benefits. Offer fair wages. Know what your competitors are paying. Offer health insurance and retirement plans when required or when available. Offer flexible scheduling. Reduce burnout by accommodating employee needs. Consider career growth opportunities. Provide promotions when practical. Offer specialized training in certain disease states or other areas. And offer leadership tracks to growth within your company. Don't forget to recognize and reward your staff. Acknowledge your employees' efforts with bonuses, awards, or even appreciation events. Once you've built a strong team, you need to invest in their training and their development for ongoing success. Ongoing training is crucial to maintaining high-quality care, ensuring regulatory compliance, and keeping your staff engaged. Caregivers love to be trained. First, initial training for new hires should be offered. Have a robust orientation program. It could take hours, but you'll need to introduce your agency policies and procedures. Provide your employees with an employee handbook that they must sign, acknowledging that they understand the basic expectations of your agency and that they understand where to locate your policy and procedure manuals with any questions. They can certainly also contact you as the administrator should any needs arise. Offer hands-on clinical training. Sometimes a registered nurse for your agency employees can be helpful with this. Teach skills like wound care, if appropriate, medication administration or medication reminders, or how to conduct safe and reliable patient transfers. Next, reliability and punctuality. Educate staff as to why it's important to be on time and to show up to your scheduled shifts. Your agency doesn't want to let a client or patient go without care, especially if the caregiver previously agreed to accept the assignment. A client that goes without care is a client that's in danger. Next, continuing education requirements. State and federal educations require home health professionals to complete continuing education. Requirements may vary by state and by business line, but some key topics include HIPAA compliance and patient privacy, ethics in home health care, Alzheimer's and dementia training, and emergency preparedness. Medicare and Medicaid certified agencies must meet annual training hours for home health aides and CNAs, along with other clinical types. Accreditation organizations like the Joint Commission, CHAP, and ACHC also have minimum training requirements, so check with them on what programs you can offer. Next, use technology for training. Online learning platforms are a great way to offer that flexible, self-paced training modules. Also, in-person workshops and hands-on training will reinforce practical skills. Offer mentorship programs when possible. Pair new hires with experienced caregivers for support and in-field orientation and work in the client's home. Training strengthens your workforce, but performance evaluations ensure that they meet or exceed your expectations. Performance evaluations will help maintain high standards of care, identify areas for improvement, and keep employees motivated. First, conducting effective performance evaluations. Set clear performance metrics. Base your evaluations on punctuality, patient feedback, and care quality. Also, what does your supervisor think of the employee? Next, use a very structured review process. Conduct regular evaluations, quarterly or annually, but have a formal template of areas that you want to make sure your employees follow. Provide constructive feedback to the review. Highlight strengths and address areas that need improvement. Set employee goals for each and every employee, whether they're in the field or in your office. Encourage professional growth with personalized development plans. Next, employee engagement strategies are always helpful. Have an open door policy or offer open communication. Hold regular check-ins and team meetings. Have recognition programs. Acknowledge top performers with awards and incentives. Career development opportunities. Offer leadership roles, certification sponsorships, and skill building workshops. Also, employee satisfaction surveys are a great way to collect information and feedback to make improvements in your agency. Engaged employees are more likely to stay with your agency and provide better care. However, you also need to ensure compliance with labor laws and employee relations. Compliance with labor laws is essential to avoid legal risks and ensure fair treatment of employees. Some key labor laws affecting home health agencies include the Fair Labor Standards Act, or the FLSA. This covers minimum wage, overtime pay, and employee classification, whether it's W-2 or independent contractors, 1099. The Family and Medical Leave Act, or FMLA, will provide eligible employees with unpaid job-protected leave for medical and family needs. Next, Americans with Disabilities Act, or the ADA, ensures reasonable accommodations for employees with disabilities. OSHA regulations protects employees from workplace hazards, including infectious diseases and injuries. Next, employee classification and overtime compliance. W-2 employees versus 1099 contractors. Ensure proper classification to avoid legal issues. Overtime pay compliance. Home health aides may be eligible for overtime under the FLSA. Also, know your state-specific labor laws, even drilling down into the city and into the county. Each state, city, and county may have additional wage and hour laws of which you need to be aware. Next, handling employee relations and workplace issues. Grievance or complaint procedures. Have a clear process for addressing employee complaints. Have an anti-discrimination and harassment policy in place. Implement zero tolerance policies for these practices and offer training about them as well. Have a progressive discipline system. Document any performance issues and corrective actions and consistently monitor these results on a regular basis, and have an end date to this plan of correction and identify the final result, communicating it to your employee. Following labor laws not only protects your agency from legal risks, but also fosters a positive work environment for your team. Now that concludes our session on workforce management for home health agencies. Today, we covered strategies for recruiting and retaining top talent, the importance of ongoing training, performance evaluation best practices, and how to stay compliant with labor laws. If you found this information helpful, please like the video and subscribe to the channel. In our next session, module number 6, we'll explore patient care and quality assurance. Thanks for joining me, and I'll see you in the next training video.